After turning 70, some medical tests that once seemed essential can actually land you in the hospital, leave you unable to walk, or drag you into a chain of unnecessary treatments. Sounds strange, doesn't it? Over the years in my practice, I've met many people who were completely healthy, with no real symptoms who, after going in for a so-called routine checkup, ended up stuck in a long, exhausting cycle of tests and treatments, and sometimes they lost their independence altogether. I'm Dr. Sarah Bennett. For over 20 years, what's troubled me the most hasn't been when patients came in too late, but when they came in too early, did too much, and didn't realize that the very tests meant to protect them were actually putting them at risk. You might think doing more tests is a way to prevent problems, to catch things early. But at this age, every time you're sedated, every medical procedure, no matter how small, becomes a gamble with your memory, your clarity of mind, and even your basic ability to walk. Strange, right? Even a doctor would refuse several tests if I were a patient over 70. Because I understand one thing clearly. Longevity isn't just about living longer. It's about living fully, independently, and with quality. Today, I want to offer you a different perspective, a new way of looking at health after 70, where not everything that can be checked should be checked, and not everything we find needs to be treated. I'm going to talk about 5 common tests that many older adults are routinely offered, but that could do more harm than good. And more importantly, I'll show you how to make smarter choices so you can avoid unnecessary medical risks and hold on to what matters most after 70, your peace of mind, your independence, and a life without dependence. First up, colonoscopy, when prevention turns risky. After 70, your body becomes more sensitive to medical procedures, especially tests that were once considered the gold standard back in your 50s or 60s. One of the clearest examples is the colonoscopy. In the past, colonoscopies were seen as a powerful tool for early cancer detection, and they truly have saved lives, including many of my own patients. But back then, our bodies were strong enough to handle the prep, alert enough to bounce back after sedation, and resilient enough to get through an invasive procedure without much disruption. After 70, though, it's a different story. First, there's the prep for the colonoscopy, which involves drinking a large amount of laxatives to clear the bowel. That might sound harmless, but it can lead to severe dehydration and disrupt your body's electrolytes. And in older adults, even a small shift in those levels can cause dizziness, confusion, and falls. Then comes the sedation. As you may know, the aging brain isn't as sharp or resilient. General anesthesia at this age can cause lingering confusion, even temporary memory loss, something many people aren't warned about. I've seen patients take days to become fully alert again, with some falling at home during the recovery period. One case I'll never forget is Mr. George, an 82-year-old man who was active, independent, and had never had any digestive issues. But for peace of mind, he agreed to a scheduled colonoscopy. Just one day after the procedure, he fell in the bathroom still woozy from the sedation and fractured his hip. From a man who once drove himself and tended his garden, he ended up hospitalized for weeks and later became dependent on his family, all because of a test he never really needed. What makes this even sadder is that the colonoscopy found nothing dangerous. Had he been properly advised, he could have simply done a less invasive screening like the FIT test, a basic stool test you can do at home. No sedation, no pain, no hospital visit, and still accurate enough to catch early warning signs of colon cancer. You see, prevention is a wonderful thing, but not if it carries greater risks than the disease itself. After 70, being proactive about your health isn't just about getting all the tests. It's about choosing the right ones for your body. And in many cases, less really is more. Second, full body scans, when knowing everything backfires. After hearing about the risks of colonoscopies, you might be wondering, well, what about newer technologies? Like full body scans, shouldn't knowing more be better? I get it. A lot of my patients, once they cross 70, start feeling anxious about subtle changes in their body. A little fatigue, a random ache, or just that lingering thought. What if something's wrong inside me? So they opt for a full-body scan, thinking it's the ultimate peace of mind. But here's the catch. Seeing everything often opens the door to a flood of unnecessary problems. Our body, especially as we age, carry all kinds of marks from the passage of time. Little spots on the lungs, faint shadows on the liver, harmless cysts on the kidneys. They can all show up on scans, but rarely pose any real threat. Still, once these things are discovered, the natural instinct for patients and doctors alike is to dig deeper. More tests, more biopsies, sometimes even surgery. And that's where the risks pile up. I think of Betya, vibrant 78-year-old woman who loved baking and tending to her flower garden. During a routine checkup, she agreed to a full-body scan recommended by a private clinic. The results showed a tiny spot on her lung, less than 1 centimeter, with no signs of malignancy. But, just to be safe, she was sent to the hospital for a biopsy. That led to a recommendation for laparoscopic surgeria procedure that sounds simple. But nothing's simple when you're nearly 80. After surgery, it took Betty nearly 2 months to walk again. Her breathing worsened, her sleep was restless, and most heartbreaking of all, her spirit was noticeably dimmed. She no longer found joy in cooking or strolling through her garden. That little harmless spot had cost her so much of her vibrancy. Now, don't get me wrong, I fully support medical technology. But I need to stress this. Not everything you see needs to be acted upon. Especially if you're feeling fine, symptom-free, and your body is functioning well. After 70, staying healthy isn't about chasing every number or scan result. It's about the art of understanding your body, knowing when to act and when to hold steady. It's about calmness, not fear. Trusting your body's healing power, not over-relying on machines. You don't need to know everything to stay well. You just need to know what matters and make the right choices. Third, cardiac stress tests, when your heartbeat gets misunderstood. When it comes to heart health, fear often outweighs what's actually going on in the body. After 70, just hearing the words stroke or heart attack is enough to keep you up at night. So, it's no surprise that many people rush into advanced cardiac testing, especially the treadmill stress test. I've had dozens, even hundreds of older patients tell me, "Doctor, I feel fine, but I still want to thoroughly check my heart just to be safe. What if there's something going on that I don't know about?" That's a very understandable mindset, and one that can easily lead you into the trap of overtesting. A stress test checks your heart while you're walking briskly or running on a treadmill, usually along with an EKG or heart imaging. The problem is, at this age, your body doesn't respond the same way it did in your 40s or 50s. Your heart might beat a bit faster. Your blood pressure may fluctuate sometimes just from anxiety, fatigue, or poor sleep the night before. But the machines might interpret those changes as abnormal and flag things like possible ischemia or high risk. The sad truth is, many of these results are false positives, meaning they look concerning on paper. But there's actually nothing wrong. But once that red flag is raised, it's hard for both you and your doctor to ignore it. The next step is usually a coronary angiogram, and sometimes a stent is placed to be on the safe side. But for older adults, every intervention carries weight. I remember Mr. Herolda, 76-year-old man, healthy, no smoking history, no symptoms, rode his bike weekly. Worried about a family history of heart disease, he voluntarily took a stress test. The result was suspicious. That led to an angiogram and eventually a stent. Unfortunately, after the procedure, Harold experienced internal bleeding and had to be hospitalized, with mild kidney damage from the contrast dye. All of this happened within 1 week, and the worst part? He had never had any symptoms to begin with. What I'm about to say might go against what many people believe. How can you not check your heart? But honestly, if you don't have symptoms like shortness of breath, chest pain, or unusual fatigue during activity sometimes, just monitoring is safer than routine testing out of habit. I often tell my patients, Let your body speak first. If it hasn't said anything, don't interrogate it with machines. After 70, your heart doesn't need to be perfect, it just needs to keep you smiling, sleeping well, and feeling like yourself. And sometimes, peace of mind doesn't come from knowing more, but from trusting your body. Fourth, repeating colonoscopies. When playing it safe backfires. Following our talk about heart over-testing, let's go back to a familiar test, colonoscopy. But this time, not the first one. I'm talking about repeating it. I completely understand your mindset. Many people get a clean result from a colonoscopy at 65 or 68, feel relieved, and go about life. Then by the time they hit 75 or 78, they start to wonder, maybe I should do it again just in case. The fear of missing something slowly eats away at their peace of mind. But here's the thing. After 70, every round of anesthesia, every bowel pre-puts your body at greater risk. We don't bounce back like we used to. Your digestive system, memory, and blood pressure all become more sensitive. And when you repeat a colonoscopy, what feels like being extra cautious can sometimes lead to serious consequences. I remember Mrs. Eileen, a 78-year-old woman, lived alone, took care of her home, went grocery shopping every week. A few years back, she had a colonoscopy totally clean. No polyps, no inflammation, no concerning signs at all. But recently, after hearing her friends were getting rescreened, she decided to repeat the test despite having no symptoms. The bowel prep left her weak, and she ended up hospitalized with low blood pressure. Worse, during the procedure, the doctor accidentally perforated her colon. It required emergency surgery. After the operation, she couldn't walk like before. Her memory declined, likely due to anesthesia and a prolonged hospital stay. She lost her independence, something she had always taken pride in. What breaks my heart about Eileen's story isn't just the medical complications, it's that they could have been avoided. I always tell my patients, if your last colonoscopy was clean and you have no new symptoms, you have every right to say no. That's not being irresponsible. That's a smart choice. After 70, being careful doesn't mean doing more tests. It means knowing when to stop to protect what really matters. Your memory, your mobility, your ability to live life on your own terms. You can't stop time, but you can avoid unnecessary medical procedures so you can hold on to the things that make you feel like you. And sometimes, real peace of mind comes not from test results, but from your own clarity and understanding. And finally, the most important point, overchecking the heart. After everything we've talked about repeating colonoscopies, false alarms from heart tests, you might be starting to see a pattern. More testing isn't always better, especially when you have no clear symptoms. But in reality, many people still fall into the cycle of overtesting, and heart screenings are one of the most common traps. A lot of my older patients, no chest pain, no shortness of breath, still insist on regular heart checks. They tell me, I don't feel anything, but let's do it just in case. It sounds reasonable. But tests done without clear symptoms can be a double-edged sword, leading you to treatments you never really needed. I've already mentioned Mr. Harold, who went through a stress test while perfectly healthy. Sadly, I have to bring him up again because his story is a lesson I hope you'll never have to learn the hard way. After that stress test, the result showed a possible blockage. Despite having zero symptoms, he was sent for an angiogram and had a stent placed. Post-procedure, he suffered complications, internal bleeding, kidney issues, and a hospital stay that lasted nearly 3 weeks. But the worst came later. He couldn't walk on his own for 3 months. He was exhausted, lost his appetite, grew depressed, and often told me, I wish I'd never done that test. I'm not sharing this to scare you. I'm sharing it to help you understand that after 70, the goal isn't to catch everything early, it's to know when to pause. To know how to filter what truly matters for your body, instead of getting caught up in anxiety about what might be lurking. Want to care for your heart? Great. But that doesn't mean constant testing. Real heart care starts with paying attention to how you actually feel. Are you short of breath when walking? Do stairs cause chest tightness? Are you losing sleep, your appetite, or your energy for no clear reason? If not, then the best thing you can do for your heart is live with healthy habits every single day. Get enough sleep, eat well, go for gentle walks each morning, laugh more, talk to the people you love, and if you can't let the fear of illness pull you away from the life you're living right now. After 70, the winner isn't the one who lives the longest, it's the one who lives with the best quality. The one who avoids hospital beds, stays independent, and doesn't spend their days regretting medical decisions that could have been avoided. Give your body a break from unnecessary checkups, and instead, give your heart permission to live at the calm, natural rhythm it's trying to maintain each day. I hope you've taken away something important today. Caring for your health after 70 isn't a race to find problems, it's a journey to protect your peace of mind. You don't love yourself more by testing more. You love yourself by knowing when to stop so you don't sacrifice your memory, your energy, or your independence for a few numbers or blurry images. You don't have anything to prove. Just live in sync with your body, listen to it, respect it, and be careful about what you allow into your life, including medical tests labeled as preventive. If anything I shared today made you pause or rethink even just one small thing, that's already a meaningful step. And if you have a story of your own, or you're facing a tough medical decision, share it with me in the comments. I read everyone, and I'm always here to listen. Don't forget to subscribe if you'd like more thoughtful, clear, and age-appropriate health advice. I'm Dr. Sarah Bennett, and I'll be right here, walking with you every small step of the way as you care for your health and your dignity in the years ahead.